Hi, it's Dr. Robert Whitfield. I'm a board certified plastic surgeon. I'm here today to talk to you about SmartGraft. SmartGraft is essentially we use SmartGraft to perform minimally invasive hair restoration. Here's the example of a friend of mine in New Jersey, Dr. DiBernardo, has done this hair restoration. This gentleman using the FUE technique and SmartGraft as the device to perform that FUE technique. So, I mean, we see all the time people are actually having hair transplantation, whether or not we take it into consideration when we're looking at them. This is Jude Law, a famous actor. He clearly had the receding hairline, a widow's peak. And in this after photo, you can see, obviously, they filled in those areas. His hair is he's wearing it much longer. Obviously, see Kevin Costner. He clearly had a very receding hairline and had a lot of grafting done to go ahead and restore that hairline, give him more natural, youthful appearance. It's not combined to actors and actresses either. We see the ball players. I mean, someone as highly visible as LeBron James has had hair restoration. He's actually had more than one procedure. We can talk about that later. Deion Sanders, Brian Urlacher, they've all had hair restoration. Deion Sanders plugged this on ESPN before he got it done. So all these people have had it done. Well, does it work? Does it hurt? What's the downtime? What's the cost? How do I maintain my new hair? These are all questions I get asked all the time. Does it work? I've showed you already. Does it work? Does it hurt? We did this under local in the office. Downtime's a couple of days. The costs vary depending on how many grafts we're doing. And maintenance, we'll talk about a new maintenance program I have with Blocker. Let's get down to it. About 80 million people have hair loss in the United States, more women than men. We know that this is a significant alteration in lifestyle, how they view their quality of life. People are more shy and introverted when they're experiencing hair loss. They wear hats a lot. They may not go out as much. So we want to do our best to correct this. Obviously, always in plastic surgery, we're striving to do things in a minimally invasive, safe approach. I chose SmartGraft for many of those reasons and others. Graft for me is, it fits in my armamentarium of minimally invasive office procedures. There's no scalpel or suturing. There's no line like there used to be. We do it under local. I also have Pronox in my office, which is just nitrous, like you get at the dentist's office. The use of SmartGraft has reduced the amount of time it takes for us to do the procedure. There's less fatigue in the patients because we're doing it quicker. Recovery time, like we talked about, is a couple of days. Get up and leave, but you have a bandage on for a couple of days. We don't have to shave it all. Here's the old-fashioned technique I was taught in training back in 2000. A line, you have to incise the scalp, take out a piece of scalp, and then take the follicles out under the microscope. Problem with this is it heals and leaves a linear scar that's visible. You can't really wear your hair short with this. Using the FUE automated technique with SmartGraft, you don't have to shave the whole head down. You can create a donor site with 1 to 2 millimeter punches that just biopsy the area. It fills in very quickly. Here's the device. Big tower, got a hand piece on it, and everything's collected in a closed system. What does that mean? The piece out, exposing to the environment, letting it dry out, letting it get hot. We have everything contained within the system. So the grafts themselves can't dry out, they can't get warm. That allows for better graft survival, and then they're kept moist like through a little misting system essentially. So just like at the grocery store, they blow some mist on the vegetables. Keep them cool, prevent them from drying out. Keep it in a closed system. All the same things that we do in any medical transplant, we're doing in SmartGraft transplant. This is my device in my office, and I always want to point out to everybody, every client, I let them know that, hey, we're keeping these cool, moist, they're not going to dry out, you're going to have better graft survival. So like I said, there's no linear scar with SmartGraft. These grafts are just moved from one place to another. Recovery, like we talked about, a couple days. And a lot of times I just do these on the weekends. I have a lot of busy clients. They can't take off time from work. This allows them to get through their work week, get it done on a Saturday at their leisure. When we get done, they take their bandage off and go back to work or work from home, like we all are experiencing. That's becoming very doable. Zoom calls, webinars, like we're doing right now. And obviously with SmartGraft, we're just doing these, like I said, in 1 millimeter extractions. This allows us to take 1, 2, and 3 follicles out at the same time. It's really a revolutionary technique compared to the linear scar you got from a standard strip excision. We're going to go over a case. This is my hair guy, Ray. Known Ray forever since I moved to Austin in 2012. Did my first haircut here, and he's been cutting hair ever since. He's experiencing hair loss. He wouldn't know what we could do about it. When I got SmartGraft, well, we lined him right up. That's my first client. He just wanted to try it, so we did about 500 grafts in his crown. Here's the front, the back, and where we had planned on grafting. So, like I said, you know, we take and do this under local in the office. I'm just numbing right up after shaving the back. He likes to wear his hair short, so essentially he fits this in and evens it out. He takes care of all my clients pre-op with a haircut as well. Once again, that's our SmartGraft device. Apologize for a little bit of clutter there around the device. We sit down and get started. We're going to do 1 millimeter extractions. You know, under local, we just got to lay there. He didn't want to have nitrous or any other medication, so he just did it under straight local and had no trouble. Well, here's the grafts. Here's what they look like. You can see that some of them have 2, some of them have 1, very few have 3. There's a lot of hair density, which is going to be great in terms of transplantation. Here's what hair grafts look like when they're transferred. They look like little tiny potted plants you go get in front of the store, and then put the bigger or a different pot when you get home. Exchange them. So they got a little bit of tissue around there. That's all going to heal down. These are all raised photos. That's what we shaved him. That's what he looked like after he extracted. And then that's him in about 2 weeks because I went and got another haircut and I figured it out. We'll just get a follow-up photo at that time. So a lot of times I'll just check on Ray and see how he's doing in a couple of weeks. So he wanted to come back later on and get some more graft. So these will all pop up now. There was his before in his crown. About 2 weeks after, and then he's about 6 months in that top right. And then here's his the anterior hairline, his donor side. We revisited his donor side, no problem doing that. And there's his anterior hairline. He's got hair now. So, you know, I'm like, Ray's ecstatic. He wants to know how to maintain his, how we use LockRx. LockRx is a drug-free treatment system that helps pre and post treatment. Step 1, you reduce the inflammation, boosts the immune system, and helps balance everything out. Step 2, we want to limit factors that will lead to more hair loss as part of the defensive system. And then 3, we're going to start incorporating this more and more in our office when we're able to treat folks up close and in the office again. And it's a combination of a small growth factor system we use with a microneedling system to instill it into the scalp. So that being said, you know, we went over kind of in terms of candidacy, you can't have a scalp condition that needs to be treated medically until it's completed. Treatment or therapy, you can't have an infected scalp or something like that that's going to promote hair loss. We don't want anything where there's areas of significant scarring, where the blood supply be compromised. We don't want somebody with a metabolic condition that's causing hair loss or medication that's causing hair loss. So once those criteria have been met, we can perform SmartGraft safely, efficiently in the office and local. Depending on how many grafts you need, will dictate the length of the session. And then once the session is complete, we'll put you on mock corrects. And so let's go over a few more examples. Here we're going to draw an anterior hairline for this gentleman, and then fill in, his receding hairline, and then be careful not to extend too far beyond that because it'll look unnatural. He may have hair loss behind it. So here he is, right after the procedure's done. And then when you look at timeline photos, hair cycle, it essentially is over a year long. So you can fill in an anterior hairline, look at it at a week, and then look at this final photo at a year, and it's a very natural appearing result. The orientation of the follicle is correct. There's hair in the proper directions. It's filled in the receding areas. Here's another example. So, when you have to do more grafting, you have to expose more of the scalp and use more of a donor site. And so the length of the time of procedure can increase in any procedure where we have over a couple thousand grafts. We'll get additional help. I'm always present for the procedure and participate in both extraction and placement, depending on what elements are needed at that time. But we can always put hair in at the same time if we can get enough hands around your scalp. We'll do that as expeditiously as possible because it can become a prolonged procedure. We do break up procedures, like I said, especially over a couple thousand grafts. It becomes too long of a day for our clients. And once again, this is good for males and females. We're going to go over a email before and after now. This is from Dr. Bansal, a friend of mine in San Francisco. This is a very good photo to show, and I show it because it's both female and ethnic, and this works on ethnic types of hair as well. Female hair pattern, female hair loss, the pattern is different. It's usually down the middle. And once again, you have to go through a metabolic workup for each of our female clients. We don't want to miss a metabolic problem. So we go through that workup. If that's all negative, then we can go ahead and proceed with SmartGraft hair transplantation. And here you can see how diffuse hair loss kind of down the middle was happening, almost as if she was parting her hair without trying, and then it just expanded on both sides from there. And now in the follow-up after a year, that's really, it's filled in nicely. She's not hiding it any. I've had female clients, especially a slightly older clientele, tell me, one in particular, she told me her grandson was making fun of her because she was losing her hair. So we transplanted her because she was receding in the middle, and it was making her self-conscious. She didn't want her grandson noticing that. Another example of more kind of not diffuse, but more down the middle, almost. You always want to treat female hair loss down the middle if you can. Diffuse female hair loss is not easily treated, and I tend to use other options like Follicles, Nutrafol, shampoos, different things to help them when they're experiencing diffuse hair loss, because I don't feel it's appropriate to treat that, whereas down the middle, we can treat that and get a very, very nice response. Just a few more examples, and we'll finish up so we can answer some questions. Finally, so kind of, if you're trying to rebuild the anterior hairline, we'll reiterate again, you don't walk the anterior hairline too far away from the existing hairline for fear of problems with hair loss behind that point, or having step-offs or transitions that don't look natural. So we always want the transitions to look natural. Here we've added more hair. This is Dr. Bansal again. He's added more hair anteriorly, and there's thickening and greater density when you look at hair also. I like this one because I have a lot of young clients who like to get the recession points anterior taken care of, even though their peak is fine, they're receding. on the sides, and that's something that's really concerning to them. So younger clients, I find this is a very commonly requested area to be treated. And then, you know, this points out again in this photo by Dr. DiBernardo, you don't want to build the hairline too far anterior. You can see where he has forehead lines and he's recessed quite a bit. So if he had started sooner in life, we probably could have preserved a more anterior hairline. But now we just walk it out and mark it slightly in front of where the hair is receding, so we don't get ourselves into a unnatural appearance. Same with this photo as well. And in this set of images too, this is a client where you can definitely get a really unnatural appearance if you walk the hairline out too far. So just in those last several examples that this one included, we're trying to show that you just treat where you can see the existing follicles and fill in and give greater density there, so that when you look through the hair follicles, you're not seeing a wide distribution of hair follicles. There's greater density. Density looks more natural. And here especially, the density improvement here looks very natural in this before and after. And some more options of that recession on the side that really is bothersome to patients. The sides there, you can really fill in nicely and create a really natural appearance. Yeah, another before and after where we're filling in nicely the areas that are becoming less dense. Time has passed, and this patient's began to have, you know, more hair loss, and it's, you know, all over the scalp. He's interested in doing the anterior portion here. Dr. Huckaway clearly did a great job filling in the anterior. Yeah. And here's a pretty start example of, you know, you've got recession on the sides, you've got anterior hair loss, you build out around and fill in the density, and that gives you, you know, this is a great result. And that's all we're looking for. You know, does SmartGraft work? Yes, it works. Does SmartGraft, you know, it's accomplished with minimal discomfort under local in the office with or without nitrous. The downtime, like he said, is, you know, a couple of days with a bandage, and really that's it. Cost, you know, for us, we charge normally $6 a graft for the first 1,000, $5 a graft for the second 1,000. That's a very competitive price in the United States. And then how do I maintain? Like here, I give you the option regarding lock racks. I think that's a very valuable tool when we're trying to maintain, you know, the results. I know that we're going to have hopefully some more minimally invasive options moving forward in the office. In this kind of new setting, we've got to be extremely cautious in protection of our clients. But we feel like hair loss doesn't need to be a forever solution. So we have SmartGraft and locker racks now to help improve those. All right, I'm going to take some questions.
All right, I'm back. Can everybody hear me? I'll take some questions. I apologize for all the technical difficulties, but go ahead. Let's have some questions. Okay, I'll go ahead and start answering the questions now that everybody can hear me. Sorry about all the technical difficulties. I think it's too many Zoom calls over the past 2 weeks. So how far do we take the hairline forward? It's really, we want to be within a few millimeters of the existing hairline. If you walk it too far forward, then if you have hair loss behind that, it'll become noticeable. So we try to stay relatively close to that hairline within a few millimeters or rows of follicles. Do we have multiple sessions of surgery? And then how do we continue minimizing hair loss? So we try to make our benchmark 2,000 grafts in a single session, and that will take better part of 4 to 6 hours, depending on how easy it is to extract and how easy it is to replant the follicles. And then if patients have severe hair loss, the entire crown recession from anterior to posterior, we didn't go over the Norwood classifications, but if you need more than one session, more than 2,000 grafts, we break those up and we use LockRx as our supporting pre and post hair transplant maintenance. And question regarding cost again. So costs are per graft costs of $6 per graft for the first 1,000 grafts, and then $5 per graft for the next 1,000. So when you looked at our hair transplants, the one I showed with my hair guy, Ray, he was only really treated with 500. He should have probably done additional. There was financial restraints at the time. So you would look at the area and roughly $5 and $6 are the graft costs. $6 per graft for the first 1,000 and $5 per graft for the second 1,000. SmartGraft is available in Europe. I was asked that. Was asked the question, what's the typical number of grafts? We do traditionally between 1,500 and 2,000. By the time typically males seek hair loss, that's a pretty significant amount of hair loss. And if it's just to look thicker, then it may just take 1,000. We'll be able to do a virtual and help decide that for you. Yeah, most of our treatments have been done essentially in one treatment setting. Out of the last 24, 25 or so, we haven't done a second session. We've just done 1,500 to 2,000 grafts. Oh, I see. This was a specific question to a region in the Netherlands. We will have to email you, Jackie, and let you know. I'll pose that to SmartGraft and see if there's a specific physician in the Netherlands or the UK. I've already got a response and they said yes. They have somebody in, a couple people in Belgium and Denmark. Is there a risk of hair not returning to the donor site? No, it's the density of the donor site that's the issue. If there's poor hair density, then you don't do the transplant. I use the example of my hairstylist Ray. He has significant density on the back of the hair. Or alternatively, if the hair is receding past the level of the crown posteriorly, you don't want to risk doing the transplant there. So you want to proceed and have people assessed earlier before they've had that amount of hair loss, so that they're not in that position. And I got another question about downtime. Yeah, so if we did this on a Saturday, you'd return to work on Monday. The bandage usually comes off on Tuesday. You can work from home that day or choose to stay home. I use the 48-hour rule for the downtime, and then we just use the cup of water technique for hair washing the first 2 weeks in my practice. Use baby shampoo and a cup of water, no vigorous shampooing. In terms of consultations, if you all contact Brett via email at brett@drrobertwhitfield.com, anyone's available to schedule a virtual consultation, and then we'll have to reward those who registered. The first several are going to get free LockerX kits. We just have to identify those who registered and get those sent out. The virtuals can be done for free for those who attended this webinar. I got to ask, is this a faster surgical method compared to others, such as like strip? For us, it works very quickly. Strips took a great deal of time, almost all day in training to do a couple thousand grafts. We can get a couple thousand done in 46 hours using a team approach. LockerX products are not included with the costs associated with the SmartGraft procedure. I have clients who use LockerX who don't qualify for SmartGraft or who are just looking for hair supplementation. This is a good question. I was asked, are there any risks of infection in the initial 48 hours? I haven't experienced anyone getting an infection, or that's a risk. These are all small, 1 millimeter biopsies, and then essentially a needle stick for reinsertion. So the opportunity for infection is incredibly limited, although it still has to be looked at if anybody calls you concerned about that. I don't use oral antibiotics post-treatment anymore. Antibiotic usage in this setting, I've avoided and have had very good results with no either incidents in increased infection or problems afterwards. There's a question regarding women with traction alopecia. Yes, this can be used. I've treated males similarly with traction alopecia from dreadlocks and have done their hair transplants, and then of course recommended that they don't ever do dreadlocks again. Waiting for more questions. I think there's some in process. I'm going to go back to some of our other items, make sure we covered everything. So again, I apologize for all the technical issues. I was having this problem on a Zoom call earlier today, so should have known better. For those who are interested in consultations, we'll be doing the free virtual consultations. And then for those who are registered to attend the webinar, there'll be discounts of $500 to $1,500 applied to those who are candidates for SmartGraft. We'll be giving some free Lock RX hair restoration kits away to those registrants as well. Do I have any more questions? Oh, I had a good question about SmartGraft and hair color. Yes, I've performed SmartGraft on all hair colors. I haven't had any issues. The hair, once it's grown in, obviously maybe slightly different depending on aging, but can be adjusted. So I haven't had any problems. It's just really the density and identification from the donor site and what, if anything, is causing the hair loss. Are there any limitations, scalp additions, genetic predisposition to hair loss, or medications that are causing hair loss? So color has not been an issue for us. Oh, this is a good question too. Can the donor site be used again? Yes, it can. In my example where I was showing my hairstylist, same donor site was harvested again, and you can't even tell it was harvested when you look at him closely for use of the same donor site. And you can also widen your donor site and carry it up on the tip of parietal scalp as needed, provided they're not having hair loss in those areas. All right, we have time for a couple more questions. We have a question about financing. Yeah, we have a financing arm that we use. It's called Patient Fi. Brett within the office will discuss Patient Fi with you. It's done in a way that doesn't give you a notification on your credit report. So it's a soft credit check. And they have excellent terms right now in terms of interest-free for certain periods of time, 6 months, 12 months. So we use Patient Fi. Yeah, typically, I just got to ask the question about if the hair color. So typically the donor site in the back will have the darker, more original hair color. But whatever that color, that follicle is transferred, that's typically what it ends up as. Question about ethnic hair transplant. Yes, that is, as I discussed the example of, I had an African American with dreadlocks and traction alopecia. You do have to be cognizant of that and make sure you get the orientation of the follicle in the proper position. But other than that, we haven't had any issues. All right, so in conclusion, we are going to contact those who registered again for this via email. Brett at Dr. Robert Whitfield will be in contact with you. Those who registered and attended are going to get a free virtual consultation, and then if appropriate candidacy is determined, then you'll be able to get a discount of $500 to $1,500 off the procedure. As we discussed, we use Patient Fi if there's a need for financing. And then we'll also determine some Lock RX winners. All right. Thank you all very much. Have a great day.